Brooklyn Independent Television.
Welcome to Healthbeat Brooklyn on Brooklyn Independent Television. I'm Dr. Monica Sweeney. Receiving a diagnosis of cancer must be one of the most frightening events in anyone's life. Patient and family are almost always beset by fear and a sense that the journey, no matter how it turns out, will feel overwhelming. Good doctors, new medical technology, the latest drug treatments are all crucial. But we want to take you to the new Cancer Care Center at Kings County to see the contributions of a relatively new player, the Patient Navigator, who helps with health insurance, current literature, appointments, the details that make such a difference as the patient moves through a deeply challenging process.
Ms. Joseph, we had a chance to discuss your diagnosis last week, and I asked you to come back today so we can further discuss it. I can answer any questions that you may have about treatment options and the plan of care from here. Any questions I can answer for you?
Give me a little more time that I can go home and decide exactly when I want to have surgery scheduled. Okay,
well you have my number. I want to introduce you to our Patient Navigator, Ms. Ford, who you can contact anytime, or if you want to stop in anytime, just call Ms. Ford and we can make arrangements to have another face-to-face meeting about the therapeutic options that are open to you.
Okay. Hey, thank you again, Dr. Lewis.
Kings County is a very, very big campus, and our patients will get chemotherapy on one floor, have a clinic on another floor. Pharmacy was 2 blocks away, and so these patients, as they become more and more precarious in their treatment, they were sort of being sent all over the place. And we felt there's a need to have one central location where the patients can come, get all their care, and hence the Cancer Care Center. Joseph, this is Ms. Ford. She's our Patient Navigator. She's the person I was telling you about. So she's going to take your information and you'll give her yours, and this way you can be able to contact us at any time.
I thank you again, Dr. Lewis.
My pleasure.
It was a pleasure speaking with you.
All right, so I'll take you to my room.
We realized that we had a lot of patients who didn't know the system. At that time, as I mentioned, we were in separate buildings. For instance, the breast cancer center was in a building that was 2 blocks away, and all their tests were done in the main APC complex. And we find that we have patients dropping out. They were dropping out because they got tired of trying to find where to go. They didn't know where to go. They became frustrated with the system. And we found that having a Patient Navigator really cut down the amount of time it took for them to get their diagnostic tests done and to come to surgery.
So the doctor said you should be having surgery in about 6 weeks or so. In order to have this surgery, you'll have to first of all meet with the financial counselor to determine, your financial position and stuff like that. And after which you'll have to get something called pre-surgery screening. That's usually done a week prior to surgery. I'm giving you all this information so you could think about your dates and how it fits into your schedule.
Once a patient is identified with having cancer, they're introduced to the Patient Navigator. From their reception, they usually require more tests. The Patient Navigator coordinates all those efforts. They coordinate with the patients when their appointments are. If they miss their appointments, they're on the phone with them saying you've missed your appointments, and to make sure that they have another appointment. And also they have a friend. It's a devastating time to be told you have cancer. They meet somebody who's caring, who has their interests at heart, who they can get to know as a friend as they go through the various stages of their treatment.
This is a very tough time for you, but I want you to know that we're here to help you. You're in the right place. We have some of the most knowledgeable and qualified staff you could find in a medical facility, and we're your support. We're going to offer you all the help and support that you need. Okay?
When I was told by Dr. Lewis, the breast surgeon, that I had cancer, for a moment, you don't know if you're thinking, it is hard for you to absorb. So I didn't cry, but it's that I was overwhelmed. So I had to go home and, get myself together, because at that point in time, you are depressed. You are depressed because you're thinking, am I going to die? Am I going to live?
All right, so you could call me anytime, because it's not every time you'll be able to make contact with the doctor. Anything at all, anything you think you need, anything you don't understand that the doctor probably would have explained to you, feel free to call me to get clarifications at any time. You know, when patients are going through breast cancer treatment, or particularly when they're initially diagnosed with breast cancer, there's a feeling of fear, sadness, confusion. At that point, they need someone to talk to, someone to handle their treatment process. I'll take you in. Hi, Marianne.
Hello.
How are you? This is Miss Joseph. She's actually scheduled to have a mastectomy, but she hasn't decided on the date yet. She has to go home and think about it, but I just brought her so you could explain the financial process to her. Okay, so, all right, I'll leave you guys to chat.
Okay,
first.
thank you. Thank you.
The first time I met Miss Ford, she was very understanding. She, of course, she empathized with me, and she gave me literature, and she told me that I should go home, read the information. If I have any questions, I can call her, and that's what I did. And that's how I gained a lot of knowledge about, you know, my present condition.
Relate to you. This one talks about cancer in general.
Okay.
You know, there's a lot of information in here that you could use to develop questions for your doctor.
Okay, I think.
Having Karen there, she's like a lay person. She fills that role. So, you know, it's important that they have a navigator.
So
I thank you again
you're
for everything.
welcome.
It was
You're
nice
welcome.
meeting you.
Nice to meet you. And remember, I'm always here for you.
Become a fan on Facebook. Like Brooklyn Independent Television.